Hi everyone, this is Dr. Chellam. Have you ever had someone get cancer treatment and you're struggling? You've heard so much about nutrition and cancer, and you're struggling to find the right nourishment for someone who is being diagnosed with cancer? Well, this is that conversation you want to listen to. So as always, shut off your distractions, listen to this. We delve deep into what is the nutrition a cancer patient actually needs. Do they need to eat before chemotherapy? What supports their recovery process? This conversation is a wealth of information for those of you who know someone who's struggling with cancer or is helping someone struggling with cancer, or if you may be struggling with cancer. Listen to this conversation, and as always, share this with someone who will be benefiting from this, and subscribe to our YouTube channel so we continue to support you in your health journey. Without any further delay, let's listen to our conversation with Allison. Welcome everyone. This is Dr. Chellam, and once again we have another phenomenal podcast. And many of you who have followed me or even been a part of our diabetic summit are quite familiar with Allison Tierney. I hope I pronounced that.
You did.
Okay. And she is a registered dietitian, is also board certified in oncology as a dietitian. And so why is that important? We always talk about food being medicine. And I think there's no other field of medicine where food is so powerful. When you get a diagnosis of cancer, it's almost a death sentence for most of us. And to really come to have that knowledge, that awareness, that food can actually impact as to whether you're going to get cancer or not. It does have a role in it. And even when you get cancer, how do you get the best out of the disease? Because when you look at the traditional treatment of cancer, it has not changed for the last 55 years. We are still chasing the last cell. And what we should be focused is on the very first cell. How does it come? What feeds it? What can destroy it? That's what we need to talk about. And so this podcast is extremely important for those of us who are worried about cancer, who have a family member affected by cancer, and to think that you have some power. It's not just about the doctors giving you radiation, chemo, and surgery, but you can actually impact and change the trajectory of your cancer, I think is very empowering. So I'm really looking forward to this conversation. Welcome, Allison. So good to see you again.
Thank you so much for having me. It's a pleasure to be here.
Awesome. So let's start with how I always talk about with all of my guest speakers is tell us your journey into being a registered dietitian, particularly your interest in the field of oncology. Why would you be interested, and what makes you say that food actually has any impact on the development of cancer or even the treatment of cancer?
Yeah, absolutely. So I actually went to school the first time for business. So I have a bachelor's degree in business and leadership and management. And it seems kind of weird for me to mention that, but while I was in school, I was mostly interested in nutrition from the perspective of sports performance. I was an athlete in college, and I always wondered how could nutrition improve my performance. But when I was in college working on towards achieving that business degree, when I was a freshman, my mom was diagnosed with breast cancer. And when I was a senior, my grandfather was diagnosed with liver cancer. My grandmother was diagnosed with breast cancer. My godmother was diagnosed with breast cancer. And then my other grandmother actually passed away from lung cancer before I was born. So all of these cancer diagnoses started to pop up in my family's life. And I just started to switch my shift of thought about nutrition as it relates to sports performance over to as it relates to chronic disease and cancer, because I was really interested to learn about, could nutrition have altered the paths to the cancer diagnosis? Could it help them during the course of their treatment process? And could it help them into survivorship? And as you can imagine, I probably wouldn't be speaking with you today if I didn't find that the answer was yes, yes, and yes to all those situations. So after I graduated with my degree in business, I actually went back to school to get a bachelor's of science in dietetics and became a registered dietitian, and then continued on to receive my master's in nutrition. And during that time, when I decided to go back to school to be a dietitian, I told all my professors that I wanted to be an oncology dietitian. That was really important for me. And the reason why I wanted to share with them my interests and what I wanted to do with it was because we don't actually get a lot of training in oncology during dietetic school. I can actually recall we only had one 1-hour lecture in all of dietetic school about oncology. So I asked for every opportunity possible, took every shadow experience possible to learn about oncology nutrition. And thankfully, because of that, I was able to have an internship as an outpatient oncology dietitian before I graduated, and had some really great experiences with a well-known national cancer center, and actually was hired on full-time after my internship and became an outpatient oncology dietitian there. And so it really stemmed from that wonder about how could nutrition play a role in my family, but also beyond that to everybody. And, as somebody who has such a big family history, I've always thought to myself, nobody's invincible from cancer, right? It doesn't discriminate by age, gender, race, ethnicity, culture, you name it, does not discriminate. But my goal as an individual is, if I can live my life with a healthy lifestyle and a healthy diet that can help reduce the risk of developing cancer someday, if I am ever diagnosed, I can look back and say I did everything that I could. So that's kind of where it all stems. And now I have a private practice where I work with oncology patients to help them throughout the course of treatment as it comes to side effect management, because there are several different types of side effects as it comes to cancer treatment that can impact nutrition status. But also, one of the biggest things I'm most passionate about is the prevention of cancer in the first place, or prevention of recurrence. So that's really where I focus a lot of my clientele on, and how I work with clients.
So basically, nutrition can not only prevent cancer, it can prevent recurrence, and it can also help you with the side effects of the existing treatment of cancer.
That is correct. And also, we do know that research shows that during the course of treatment, adequate nutrition and improved nutrition can actually improve the outcomes of cancer treatment, and making chemotherapy more effective, improving quality of life, boosting mood. I mean, there's so many great benefits of proper nutrition throughout the course of treatment as well. So yes, it can help prevention during the course of treatment and prevent reoccurrence.
I apologize for that. Give me 1 second. So this is this has been my experience. I have somebody very close to me diagnosed with cancer, and I have had several patients. One of the bigger challenges is, and as you well know, not everybody is trained in the right kind of nutrition, whether it be dietitians in the hospital setting or physicians. And they usually push for a high protein diet so they can withstand chemo and radiation, right? And a high protein diet in all our heads is a lot of meat. And the more protein you consume, the other thing which I've noticed cancer patients do is they have this craving for sugar, and they tend to have pop and candy in their stand. I still remember this, when they get diagnosed with cancer, get chemo or for testing or for radiation, they're admitted to the hospital for whatever reasons. That's usually their nourishment, high protein and lots of sugar. So let's delve a little deeper into your journey of what you were taught, and how does oncology nutrition differ, and what is the right thing? Is the high protein diet really the right thing for most patients with cancer, or is every cancer patient different?
Well, that's a great question. There's a lot to unpack there for sure. However, to start off with the high protein, it's so common for physicians, oncologists to tell a patient when it comes to when they're going through treatment, you just need to eat a high protein diet. And like you said, that often relates to a lot of people eating high amounts of animal-based proteins like chicken or beef to help meet those needs. Well, the truth of the matter is it true that your protein needs are higher during the course of treatment? Yes. However, they are not significantly higher that we need to double down on animal-based protein. And so, for example, I had one of my patients when I was still working at a local cancer center. The physician told him that he should be eating a high protein diet, so he was doubling down on the meat and so forth. But this particular patient had kidney disease as well. And for those who are familiar with kidney disease as it relates to protein, we actually want to have a low protein diet because protein can actually damage the kidneys even further because the kidneys are having to filter out that extra nitrogen waste product. So here we have this individual that has colon cancer and kidney disease, and he's telling him to eat a high protein diet, but not taking into account the fact that this individual has kidney disease, but also has colon cancer, which can be highly reduced through nutrition as well. So unfortunately, you're right. Not a lot of people are very trained in this. And I had to go back to the physician and say, here, these are the reasons as to why we don't want to adopt this for this patient. We want to adopt more plant-based proteins and depending on, types of his treatments to help reduce the strain on his kidneys, but also to help reduce the risk of the cancer recurrence and help against the cancer. So what a lot of people don't know is that too much protein is not a good thing for our bodies. Too much of anything is not a good thing. But a lot of people seem to forget that too much protein is harmful for us as well. Increased protein needs, especially animal-based protein, is linked to several different types of chronic diseases, such as some cancers, osteoporosis, heart disease, accelerated aging, diabetes. I mean, the list goes on and on, but if that protein intake is actually plant-based protein intake, the risks are eliminated or drastically reduced just because of the type of protein it is when it comes from plant-based proteins. So to answer your question in short summary, yes, you do need a little bit more protein if someone's going through cancer treatment, but it's not as significant as most think. And therefore, I do encourage people that are going throughout the course of treatment to make sure that they have access to an oncology dietitian that is board certified and knows the information and can help adequately inform them about how much protein they actually need because it's just not nearly as much as they think.
Yeah. And also it's very important for people to understand what is the difference between plant-based protein and animal-based protein. The animal-based protein, the way I've been able to simplify it, is always accompanied by fat, usually a saturated fat or cholesterol-based fat, and the plant-based protein is always accompanied by fiber. And there's a huge difference and sometimes it makes me wonder whether it's the fiber that's more important than actually the protein itself. But you could speak to that. So if somebody has to understand, I'm having radiation and chemo, and I'm going to get weak if I don't eat a little piece of chicken or a little piece of fish. How can I get to do just plant-based protein? How would you educate?
Yeah, well, first and foremost, if someone has a lack of energy, it's not usually because they have a lack of protein, it's because they have a lack of carbohydrates. And everybody has this, I shouldn't say everybody, but a lot of people have this negative viewpoint of carbohydrates, and that carbohydrates are this very negative thing, but the right type of carbohydrates that come from whole grains, legumes, fruits, and vegetables are very positive carbohydrates that fuel us and give us energy. Yes, I'm not advocating for refined carbohydrates like sugar and white flours. That's totally different. But most people need actually the complex carbohydrates to actually help fuel their energy when they're going throughout the course of treatment. So that's something to keep in mind, is that you can absolutely get the energy needs, but also when it comes to protein, all whole plant-based foods have a source of protein, even fruits, which, they're not significant. However, there is a significant amount of protein in plant-based products such as legumes, which are beans and lentils, tofu, tempeh, but even whole grains and different types of starchy vegetables. They all have protein in it. What a lot of people don't realize is that their needs are just not as much as they need. So I can give you the pure example of myself. I'm 140 pounds. And so my needs of protein are actually about 36 grams to 51 grams per day. And that estimation is based on the World Health Organization to the RDA recommendation, or the recommended dietary allowance. And if you have, just to give you a little bit of reference too, a half a cup of black beans contains about 8 grams of protein. That's pretty significant when you think about those 36 grams of protein, which is the low estimated needs. So it's a lot easier to meet those needs than a lot of people think it is.
Got it. So someone who's getting, who has a strong family history of cancer, as we know, 35% of the cancers around the world are preventable. And we don't realize that because it's mostly due to environment. Now, a family history does not mean anything, because people who undergo genetic testing will always say, my mother had, my aunt had cancer, but none of us have the genes. So what's wrong? And usually it comes down to the interaction of the various elements of the environment. But somebody is worried, they have a strong history of multiple cancers. Like, for instance, your own family, you spoke about breast cancer and 2 of the members and liver cancer. How would you counsel them to prevent? What is the process through which you take them? And what is the main shift that they would need to make when it comes to nutrition?
Yeah, that's a great point, in that, there's a very small percentage of cancers are actually genetically related, meaning that a specific gene mutation caused an individual's cancer. Right. So someone that has those high amounts of family risk factor may consider to have their genes looked at and have genetic counseling to see if they do have any of those genes, because it is true. For example, a BRCA1 mutation can actually increase a woman's risk for breast cancer about 80%. So that's a much larger risk than somebody that doesn't. But at the same time, whether somebody has that gene or not, or somebody that's just looking to reduce their risk of cancer, I'm going to recommend the same thing, which is to adopt a more whole food plant-based diet, or adopt an exclusive whole food plant-based diet. And the reason that this plant-based diet, or a plant-focused diet, can be so beneficial at reducing cancer risk is multifactorial. And that kind of goes back to what you were saying. Is it more because of the fiber that's in the plant-based protein, or is it the fact that it's plant-based protein? I think that there's several different factors there. One of them is the fiber. Fiber helps get rid of excess toxins and extra hormones, for example. So, if we have fiber within our diet, when our liver picks up the excess hormones and secretes it, what it does is it brings it from the liver to the bile duct and into the GI system. If you have that fiber there, it can pick it up and excrete it through your stool. So you're getting rid of these excess hormones that can, for example, increase the risk of estrogen-positive breast cancer. So the fiber absolutely plays a role. Another piece of the puzzle is likely, and research has shown, the phytochemicals, or the phytonutrients that are found within these plant-based foods. These are plant-based nutrients only found in plants that have been identified to help reduce the risk of cancer and other chronic diseases by reducing inflammation, helping to prevent the spread of cancer cells, helping to regulate hormones, and also, very importantly, to help reduce the risk of DNA damage and even reverse damage that has already happened to that DNA. So the list goes on and on, but when you adopt a plant-based diet, the great thing is you are including all of these great cancer fighting products, but the other piece of it is you're reducing the animal-based products that have been linked to increase the risk of cancer, such as processed meats, red meats, etc.
And does egg play a role in this, and milk products?
Yeah, absolutely. So unfortunately for a lot of people, dairy does play a big role, and so do eggs. dairy is highly linked to something called increased IGF-1, which is insulin-like growth factor. And it's just exactly what it sounds like. It's a growth factor. So as you can imagine, we actually have small amounts of this IGF-1 naturally within our body, which we do want to have. We want our hair cells to turn over, our skin cells to turn over, all of the above. But what we don't want is excess growth, because cancer, for example, is uncontrolled cell growth. So when we have high amounts of dairy and other animal proteins through meat, our IGF-1 tends to increase. And the other thing about dairy is that it also increases our exposure to hormones that come from animal-based products. So there we're getting increased sex steroid hormones like the estrogen and progesterone, for example. Eggs do also play a role, and that starts getting into a little bit more of choline and carnitine, which can be turned into something that is carcinogenic within our body. So unfortunately, there are a lot of negatives and increased risk factors when it relates to animal-based proteins. But overall, by increasing the amount of whole plant-based foods in the diet, you're adding cancer fighters. And by reducing the amount of animal products in the diet, you're trying to get rid of and reduce your exposure to things that can actually increase the risk of cancer. So there's definitely a twofold system there, is that you're increasing and decreasing.
Got it. So as more and more nutrition-based approaches for cancer have been experimented with, there's this huge body of information about ketogenic diets for cancer. Mm-hmm. What has been your experience with ketogenic diet? In fact, ketosis as a treatment for cancer, whether it comes from starvation or nutritional ketosis, is a huge part of cancer treatment. What would you advise somebody who's being told by, a physician or by a family member, you need to go into ketosis, you should do a ketogenic diet for this specific type of cancer? What has been your experience or your knowledge on that?
Absolutely. So as you mentioned about me before, is I'm a big believer in what does the evidence say, right? So we really only have scientific evidence to show that the ketogenic diet is beneficial in a certain type of brain cancer called glioblastoma. There has been some benefits of the ketogenic diet there, as also with pediatric epilepsy. It's been studied in breast cancer. There's still ongoing studies. However, research does not show that a ketogenic diet is beneficial, because what a ketogenic diet also incorporates is high amounts of fat, oftentimes depending on how the diet is done, but oftentimes by high amounts of saturated fat that comes from bacon and eggs and ground beef, and that's dairy one products. Piece of it. Yep, dairy products. But the other piece of it is extremely low in fiber, which we know fiber has so many beneficial qualities to reducing the risk of cancer and fighting against cancer. I would highly advise someone not to practice a ketogenic diet in order to fight their cancer or reduce their risk of developing cancer, because there's no long-term evidence or even really short-term evidence to show that it's beneficial. The research that we do have is extremely beneficial and long-term research in a plant-centered diet for reducing the risk of cancer overall. So there's no research in it. I think this studies will continue to be done, but the plant-based diet still wins out over and over again. And I think, again, it's multifactorial between the fiber and the phytochemicals and the vitamins and minerals, et cetera, which the ketogenic diet lacks. And I will not deny to someone that someone following a ketogenic diet can lose weight very quickly. However, in the long run, it shouldn't be about weight. It should be about health and chronic disease. And, yes, weight is one piece of the data point. We do want someone to try to achieve a healthier weight, but not done through a ketogenic diet. I can share a story of a client of mine who she came to me wanting to lose her weight after she had gone through cancer treatment and wanted to adopt a ketogenic diet because she had success doing it before. Of course, I highly recommended that she didn't do that. And she admitted to me later that she's like, I just thought I would just do it, whatever, not really listen to you. And so what happened is she ended up having a lot of pain in her pelvic region, and she had developed tumors on her ovaries. And this was a breast cancer patient. And so the doctor said, this was a short-term effect of her doing the ketogenic diet. And the doctors told her, we need to get surgery, get rid of them. And she said, can you just give me like a week or two, right? It was a short period of time. She stopped the ketogenic diet, went to a whole food plant-based diet very quickly. And when she went in for surgery, the doctors went in and said, it's gone. These tumors that you developed are gone. And of course they chalk it up to miracle and nothing related to the diet switch. But so it's something that I have seen patients have these difficulties with tumors because of adopting even at short term. So there's a very high amount of risk associated with adopting a ketogenic diet, even in the short term.
Got it. What about starvation, like the fasting? There have been studies that have shown that if they go fasting prior to chemo, their side effects are less. And even after chemo, if there's a 5-hour fasting window, their side effects from the chemo and radiation are less. And it's very difficult to get cancer patients to fast because for some reason, maybe because the cancer cells use glucose as their source of energy, they tend to crave sugar a lot, or maybe because they just have a poor dietary habit, and insulin resistance is an overwhelming part of their health or disease process, that they tend to crave sugar. So have you noticed the impact of whole food plant-based with intermittent fasting?
Yeah, so there's incredible research of intermittent fasting, and I know you had Dr. Walter Longo within your summit,
Yep.
And his research is quite incredible as it relates to aging, diabetes, cancer, multiple sclerosis, etc. But yes, there definitely is benefit of adopting some sort of fasting protocol, whether you're going through treatment or not, just like a regular healthy individual. And but when it comes to fasting prior to chemotherapy, it's pretty fantastic results that people are experiencing. The protocols are, slightly different, but usually what I've been seeing is a 72-hour fasting window, with 48 hours of that being before chemo and 24 hours of it being after chemo, where they're consuming very low amounts of calories, anywhere between 500 and 250 calories per day. But what they are experiencing, just like you mentioned, is very low, very minimal side effects, if any, as it relates to the chemotherapy. And what the research is finding is that what it allows the cell to do is to essentially, is to impact those cancer cells at an even greater level. And instead of impacting the healthy cells, which is where we experience all those side effects. So yeah, there's incredible research on it. It has not become widespread protocol by any means. And I know that there's a lot of oncologists that are still very skeptical about it and concerned about it, but I think it's definitely something to watch, keep an eye out for that information, and to possibly start making those protocols across the country, because the results Dr. Longo has had are pretty fantastic.
Right. And I think this is one of the reasons we do these podcasts, is people are not aware of a lot of the research that's going on. And a lot of the doctors are not aware of a lot of the research that's going on. Everybody's focused on weight loss, right? No matter how much you and I shout from the tops of the roof saying it's about your health, not about your weight. Your weight is a side effect of your health. People still are hooked onto weight issues. So the research that's going on should be impacting diseases. Like we want to make an impact on cancer, heart disease, the leading cause of deaths across the board, across the world. And then, of course, diabetes, which actually feeds into both of these diseases. And then autoimmune conditions. I mean, we have a very broad range of diseases. All of them are impacted by nutrition and high fiber, basically, and all of them are impacted by giving that rest period and creating that ketosis with fasting. So somebody who is completely novice to nutrition and its impact for cancer, I think the bigger challenge would be for patients to navigate between a a dietitian or a nutritionist who is helping them with a whole food plant-based or going into ketosis mode, and the doctor's belief system. How do you coach people to speak about nutrition with their doctors? One of the things I tell my patients is, if they don't ask, don't tell. That's my policy, because it gets to be. But though I would say a lot of oncologists, as long as the patient is doing well, they say continue doing whatever you're doing. They don't want to know the details. But most patients feel like they have to include their doctor in this process. What are the tools you provide for them to have that discussion in a very science-based manner?
Yeah, well, I think the biggest thing is, some physicians aren't going to ask about their nutrition. Some of them are. But my standpoint is that my role is to teach someone about the research and the education so that they can understand it in a very easy to understand manner, and also so that they can relay that information to someone like their physician. So something to the point is, when someone, even if you're just at a family gathering and someone says, why are you adopting a plant-based diet? I want them to have the tools and the knowledge to be able to communicate why they're doing it for somebody. And I think that's very important for not just having these conversations with other people, because in the end, what someone's business is someone's business, right? But in the very end point of it is that I want my clients to understand why they're doing something, because it motivates them to stick with it. I always tell people, I don't need to tell you that fruits and vegetables are healthy for you, but if I can tell you why broccoli is so beneficial to fight against cancer, you're going to be a lot more inclined to eat more broccoli and cruciferous vegetables, because that's something that you're going through. So I truly believe that if I can give them the tools and the knowledge to help understand what they're doing, they can relay that information to family, friends, and their oncologist as well. I'm always open to talking to my clients' physicians, or being able to share research with their physicians so they can go into their appointments and say, here, look at this, and this. I do think there are certain cases where an individual should absolutely talk to their physician about what they're doing. And I'll be honest with you, since it's not a standard protocol right now, I would want someone to tell their oncologist if they're doing the 72-hour fasting protocol with their clients or with their oncologist, because the way it works in my practice, I'm virtual based and I'm a registered dietitian. I don't have access to draw constant labs for an individual and so forth. So I think there's monitoring that needs to be done that's outside of my scope of practice. But it's something that we can talk with the oncologist together with. And like those types of things I think are very important. And I can give you the example for myself. Granted, it's not cancer related, but as my husband and I were going through infertility, and I know we talked about this on the summit, but I didn't really talk to my OB at all about my diet, but she also knew that I was a dietitian, and she kind of just she respected my profession and what I did and so forth, but I didn't really talk to her about it because I didn't really need to. I didn't think it was necessary. And, thankfully I get to tell you the end result was a beautiful baby girl. So, but I think I kind of agree with you from the standpoint of like, if they don't ask, don't worry about it. With those rare occasions that I do think it's important. And I would tell my clients, you should talk to your doctor about this. So I'm very focused on making sure my clients, know when it's appropriate, and versus if you want to share with them, you can type of thing.
It's not inappropriate, but I think it causes it's a source of confusion for a patient who's just beginning their health journey when they get a catastrophic diagnosis, and they've worked with you or worked with somebody like me, go on a whole food, plant strong diet with lots of fiber, and they walk into their oncology, and the oncologist in passing says, make sure you're on a high protein diet. And that's when the confusion hits them. So they need to be empowered to stand, basically understand why they're doing what they're doing. I think that's where the confusion comes for the patient, because the patient gets caught between a nutritional intervention and the doctor's belief in, you need to be on a high protein diet because I'm giving you chemo radiation.
Right.
And I think that becomes very important, and that's why I bring up that point. So being diagnosed with cancer, changing their diet or trying to do fasting with a good diet, how long does it take for patients to feel the impact of the diet in your experience? I know it depends on the stage of the cancer, the age of the patient, and a lot of other things, but in general, how do they know that they're on the right track?
Yeah, you're right. It does vary from patient to patient in so many different factors. However, many people notice it within a matter of days or even a short couple of weeks. And most people experience it from the amount of energy they have, improvement in their bowel movements. And though, I think sometimes we underestimate the power of a good, healthy bowel movement. But, a lot of my clients will say, like, I'm sorry, this is too much information, but man, I have been having fantastic bowel movements. And I think oftentimes we forget about that really does the body good. And so it's really, there's so many different things that they experience. And sometimes it's also that they're experiencing like clarity in their mental state, less brain fog, ability to focus on their work. So, I have a lot of clients who are going through cancer treatment and still working, whether it's full-time or part-time. And it's really important to be able to have that focus. So oftentimes they start to notice, the energy, the bowel movements, the mental clarity / brain fog lift, as their first, side effects. And if they're going through the course of treatment, minimal side effects in terms of the nausea or bowel changes, mouth sores, etc. as well.
Perfect. So in terms of the questions that they should be asking when they get diagnosed with cancer, is there anything that's specific that you would tell? Because most people will ask about nutrition, and invariably the doctor is going to say, no, you don't need to do anything else. You can just continue to eat what you're eating. And what would you tell a patient who gets a diagnosis of cancer? What are the things that they need to think about? Because in our minds, like I mentioned right in the beginning of this conversation, 55 years treatment of cancer has not changed. We're always chasing the last cancer cell when we should always have been careful about the very first cancer cell. And in the process, one of the statistics I read was almost 50% of the patients die from the treatment rather than from the cancer itself, which is very sobering statistic when you really look at it, where you're going for a treatment that's potentially supposed to help you with the disease, but can actually kill you. And that's like a toss of a coin when you see 50%. And that's not very good. So for patients who are listening to this, if I get a diagnosis of cancer and my doctor says, no, you don't need to do any change in diet, how do they approach that?
Yeah, that's a really great question, because if your physician tells you, your oncologist tells you that nutrition plays no role throughout the course of treatment or the development, I would definitely not take that oncologist's opinion when it comes to nutrition. Not to say that they aren't an expert in oncology, but not necessarily nutrition, and find a dietitian, board certified in oncology nutrition, that emphasizes a plant-based diet. Doesn't necessarily need to be someone who focuses exclusively on only a plant-based diet, because international guidelines, the World Health Organization, the AICR, like the list goes on, all talk about adopting a plant-focused diet when it comes to the prevention of cancer. So someone that tells you that it doesn't matter isn't reading the information, isn't reading the research. And so find someone that knows the information, hopefully like myself, or but there's so many that can be across the country, and get the information about someone that actually deals with it, patients that are going through this. Because the way that I look at it is, I'm a registered dietitian. I have a bachelor's of science in nutrition. I have a master's degree in nutrition, certification in oncology, and I dedicate my life to oncology nutrition. And your oncologist dedicates their life to oncology with chemo, radiation, which is all great, but they don't have the time or the ability to focus on nutrition. So find someone that does have that and the passion to do it, because I think they're going to be in a great place to help you out.
Right. And I think the recent guidelines from the Cancer Society is about adding lots of fruits and vegetables and and really reducing the red meat. They speak of processed meats, a reduction of processed meats and meats in general. So that's a bold statement coming from such a big organization that never spoke about diet and its impact. We know high-fat diet is one of the common reasons why people develop breast cancer, and alcohol is another one, 21% increase in breast cancer. And colon cancer, there's more information about liquid sugar, basically sugar that you drink that finds its way to the colon is something that triggers off, because these are our fast multiplying cells. So there's a lot of information on why you get cancer. So the treatment and the prevention, or the secondary prevention of cancer, can be optimized, improved, and probably really made better. The whole experience of treatment of cancer can be made better by shifting your nutrition. I really wanted that to be the goal of this conversation, and I think you've brought that around and talking about a plant-focused diet. Is there a question that I should have asked you and I haven't asked?
No, I don't think so. I think that we've talked about a lot. Obviously, there's so much more when it comes to cancer nutrition, but I think the foundation is getting that fiber and those phytonutrients in and reducing the animal-based proteins. But I truly believe in just kind of what you mentioned, is that nutrition should be a complementary treatment to the rest of cancer treatment. Oftentimes people think of my work as alternative treatment, and I don't understand how nutrition should be an alternative, and it should be the foundation. Yeah. And I am not necessarily, I want to do what my clients want to do, but I believe that if someone's going through chemo and radiation, adopting a specific nutrition protocol to help with that is only going to aid in their results in a positive way. So hopefully, this can influence someone just to make small changes, and it doesn't have to be overnight, but small little changes make big strides in the end.
Yeah, and I think we speak so much about prevention, but we rarely practice it. And this is the simplest and easier way, especially as this interview is being done. It is, we're in the middle of a pandemic, and there was no more emphasis on health and why you should not be inflamed in order to deal with this pandemic. So I think people are more and more aware that their health plays a huge role. Your body is called the terrain. The terrain has to be good so that disease doesn't, the weeds don't grow wild. And nutrition is a huge part, or the fuel of the body is a huge part in that journey. So once again, thank you so much, Allison. I really enjoyed this conversation always with you, and I'm sure this is going to benefit someone who's listening to it, a survivor of cancer, or someone who is confused about the nutrition with regards to cancer, or somebody is undergoing active cancer treatment. There's so much you can do for yourself. And hopefully this conversation will get you that information that has been missing. Thank you once again.
Thank you so much for having me. I really enjoyed being here in our conversation.
Hey guys, I hope you enjoyed this podcast. Do me a favor, please subscribe to our YouTube channel, and on iTunes, download it, share it with someone whom you believe will be helped. Because a practice like ours can continue to sustain ourselves and support you in your health journey only if you support us. And the least you can do is hit the subscribe button and connect with us. Go on to our website, holisticicon.com, and also subscribe to our newsletter. Be a part of our webinars, our workshops, and our challenges. We love to connect with you. Don't forget, subscribe to our YouTube channel and share this with someone else whom you believe will benefit from it.